Hello, and welcome to another vlog. It turns out that today is International Guide Dog Day, so give those dogs a pat on the back. Figuratively, of course. Anyway, this week's theme is Inflammatory Bowel Disease, or IBD. So today I thought I'd talk a little bit about the different types of IBD, and also talk a little bit about some of the treatments for IBD. So inflammatory bowel disease is a group of conditions that cause inflammation of the gastrointestinal tract, so basically the digestive system. And there's two main types of IBD. These are Crohn's disease and ulcerative colitis. So Crohn's disease can affect any part of the digestive tract, but it normally affects the small bowel. And it causes patches of inflammation, which can penetrate both the inner and outer lining of the bowel. So as you can tell, it is a very serious condition that can cause a lot of very serious problems. Then there's ulcerative colitis. Now, ulcerative colitis only affects the colon, and it causes continuous inflammation, but that inflammation only penetrates the inner lining of the colon. However, as the name suggests, it can also cause ulcers, and those ulcers can be very serious and can also cause some very serious problems. So they are both very serious conditions. There is a third type of IBD known as indeterminate colitis, and basically that's just a fancy way of saying that the symptoms, it's not clear if the symptoms are being caused by Crohn's disease or colitis. In other words, the person hasn't yet been properly diagnosed, but they do know that they have a form of IBD. So as you can imagine, all three of these conditions are very serious, and they can cause some very serious and life-threatening health issues, from colon cancer to bowel obstructions or bowel perforation, right? So because of that, people with Crohn's and colitis obviously need to take good care of themselves and take all the steps necessary to keep themselves healthy. And because of that, it's very important that they get the right kinds of treatment. Now, there's three main treatments for IBD: medication, surgery, and nutrition. And I'll talk about each one of them briefly. So there's a variety of different medications that are used to treat symptoms of Crohn's and colitis, depending on what aspects of the disorder they're looking to treat. So sometimes they'll use steroids to help reduce some of the inflammation caused by these conditions, and then other times they use immunosuppressants to prevent any autoimmune responses by the body, because Crohn's and colitis are believed to potentially be caused by an autoimmune response by the body. So the immunosuppressants are used to kind of help prevent that, and then sometimes they use antibiotics to treat any infections that the individual may have contracted as a result of their Crohn's or colitis. And there's other medications that are also used depending on what other aspects they're trying to treat. The next treatment is surgery. Now, the main surgical procedure that they use to treat Crohn's and colitis is what's called a colectomy. So basically, they remove part of the bowel. They'll remove the part of the bowel that is damaged and inflamed to help reduce some of the inflammation. And this can be an effective treatment, but obviously when you remove part of the bowel, that can cause a number of other problems. So sometimes they'll have to reroute the bowel so that the individual can continue to defecate normally. Right? And obviously surgery doesn't always work, but it can be effective, which is why it's one of the main treatments. And then finally, there's nutrition. Now, sometimes they'll put people with Crohn's disease on feeding tubes. They'll either inject the nutrients right into their stomach or right into their blood, depending on what type of feeding tube they're using. And then oftentimes they'll put people with Crohn's and colitis on special diets and restrict what foods they can and can't eat, because there are certain foods which can aggravate the condition and worsen the inflammation and some of the other symptoms. So those are the three main treatments for Crohn's disease and colitis. That's just a brief overview of the different types of IBD and the treatments for IBD. Now on Thursday, I'll be releasing a video in which I talk more about what inflammatory bowel disease is, what its symptoms are, and how it's treated. So like, comment, and share and subscribe if you want to see that video. And as always, if you enjoyed today's vlog and you want to see more videos like this one, then please support me on Patreon. Anyway, thanks for watching, and see you on Thursday.